Hi, I'm Candace Grant and I'm your postural specialist. So welcome to joining me for 10 sessions of posture therapy. Today we are going to discuss balance. So the key thing to balance is also understanding where your body needs with postural foundation, because postural foundation is by far the greatest thing that you can ever learn for yourself. So when we talk about posture foundation, the key elements we have to keep in mind is understanding where our joints belong. So the first thing I want you to do is stand up if you're in a seated position. Make sure that you don't have shoes or socks on. If you're just starting this journey of your posture, I would suggest having someone take photos of you, front, back, side, and just see what is happening in relationship to your body. You may notice some key elements that you didn't actually realize you were doing. The thing is most people say, oh, I have bad posture, but then choose not to do anything about it. Because the thing is they don't know where to start. They think, if I just draw the string up or just shift my shoulders back, that will give me great posture. However, that doesn't take into consideration what your feet are doing, what your knees are doing, what your hip is doing, what your pelvis is doing. It doesn't take into effect your shoulder. All it's doing is opening your chest up into this position, which is not functional, right? So obviously when you're not paying attention, you are going to go back to that poor posture positioning, right? We all know that we have bad posture. The question is, what are you willing to do about it? So first of all, I want you to stand up, as I said, put your arms down and just feel how you're standing in your body. Are you leaning one way or the other? Are you leaning forward? Are you leaning backwards? Are you leaning to one side of your foot, the front, the back? What is in connection with your weight-bearing distribution? What can you feel is happening in your body? Even if you go to a mirror, look at yourself in the mirror, see what is happening. So the first thing we want to take care of in posture foundation is basically starting to align your joints through body awareness. So the key is that you want your feet to go straight ahead. You want your ankles, your knees, your hips, and your shoulders to all be in alignment. So even if those are in alignment, it's what is happening to your head. Are you shifting it to the one side? Are you turning? What is going on? Because as soon as you start shifting to one side, you're shortening all these muscles, lengthening all these muscles. So your body should be symmetrical and balanced, front to back, left to right, symmetrical, balanced overall. So if you're not balanced, you will have certain issues that obviously will come up later in life. If you are not feeling any of the symptoms right now, chances are you will later, right? Those are those little pokes that, hey, say, oh, I grabbed a pen and I threw my back, right? So all of the threats in life have gone into a bucket, and now all of a sudden you do one sharp motion, and that's the pain that drips out. And then we think to ourselves, I'll just leave it a few days and it'll go away. The problem is it doesn't. It starts stacking all those little issues on top of the other until all of a sudden you can't move because you haven't listened to the symptoms as your body goes along. So first, standing or straight positioning, making sure that your knees, as I said, are facing forward. Whatever direction your knees are, that's the direction that your hips are. Great. So now what I want you to do is stand on one foot. So you're bringing your foot up in the sideways position and you are just holding. I'm on a mat, so I'm not used to it. And just holding that position. So you want that 90 degrees and 90 degrees positioning and that holding position. So even as you can see from the side of me, We want our ankles, back of our knees, our hips, our shoulders in alignment with also our ears. So you want more of this straight positioning as well. So once again, just lift. If you feel like your foot is wobbling, that is normal because your body's trying to find balance. If you feel like your hip in here is kind of screaming at you, it's because it's tight. It's all of a sudden now trying to shift this pelvis back into position to compensate for that coming forward. Then you want to switch and go to the other foot, bringing that once again up into that 90 degrees. And it may take you a few times, especially if you haven't done it, but it's a really great exercise to do every day, which will actually help increase your balance by doing this exercise every day. So another great thing to do is to stand in what we call an inline glute. So standing in line, you're just gonna bring one foot behind the other, standing, and you're gonna actually lean back towards the back foot and see if you can do that. And of course, as I said, you're going to wobble a little bit as your feet are trying to find balance in what is going on. And you're just gonna hold that position. And then you are going to start tucking your butt. So you are doing what we call glute squeezes. So this is called an inline glute squeeze. And you want to squeeze your glutes 20 times. And then we shift legs, putting the other foot in front. Okay, and just feel if one side is firing more than the others. If you feel like your foot is going out, just push it down where it's underneath the ball of the toe as well as the inside heel for better balance. Okay, and then switch legs, putting the opposite one in front. Just try to make sure that your foot is not twisted. So if your foot is twisted, your one heel may come out a little bit more, and that is showing you that external rotation within your hip. If you need to start off by holding onto a wall to get in that position, or same with in the start position where you bring your one leg up, that is fine too. So once again, lean towards the back leg rather than forward. That way it shifts that pelvis into a proper positioning. And once again, squeeze 20 times. Can you feel one side activating more than the other? Okay. From there, we're going to test our balance with a little bit bigger task, which is we are going to do what's called an airplane. So with an airplane, you are going to stand on one foot, bringing the other one straight back. You can bend this forward one just a little bit. Your toes are going to point down and kind of in, and then you are going to hold that position. So you want to come down as much as you can for being a flat back, pushing in and holding. And you can hold that up to 30 seconds to a minute. And then once again, try the other side. As I said, this is great for balance and increase spatial awareness of what is going on in your body. If you want to know how far your body out is actually out, come stand against a wall, feet against, put your head back as much as possible, as long as it's not looking up, but looking more forward. Bring your shoulders back as much, and then bring your arms open, just like this. So this will bring your body back into alignment. Now you may find certain areas of your body will kind of almost poke you, telling you that they're a little bit more straight, and that is actually just showing you where you need more work in your body because it's probably doing a lot of the compensating, or maybe you have stayed on that foot, that side, a little bit too long, and therefore it's activating those muscles. So Those are your 3 balance exercises, plus the spatial awareness of where your body is. Thanks for joining me, and I will see you in the next chapter.